If I might go ahead. So to
Yes,
welcome
go ahead,
Minister
Aisling, yeah.
Butler here today. It's great to have you, Minister. And I know to meet all my colleagues again, I suppose, in session, which is wonderful. And I want to thank, I suppose, my colleagues for their excellent questions, and Gahirlik as well, I suppose, just to follow up on our mental health report as well. And also to welcome the representatives, I think, here from the HSC. It's really important that we're getting this engagement with the department, with the HSC, and I suppose with mental health services. I suppose, Minister, it has been a really trying time. I suppose, firstly, just want to pay tribute to people in the healthcare services, particularly on our front line. And I suppose for me, that's the paramedics, the fire brigade, the firefighters. I suppose I'm thinking specifically here of when it comes to acute issues, when it comes to mental health. Hand on heart, I suppose I've been going around the area recently, my own local constituency, and I've told people, I sit on the education committee and I sit on the mental health committee, and I have been pretty taken aback. Some people have been very open in sharing very, very traumatic experiences in their lives and very recent experiences. And I'm speaking here about the loss of life or accidents, that could be related to that. And it's been a very shocking, very sad. And I suppose it's really hit me in the last couple of months when I've been able to meet people outdoors in a safe way. I suppose some of the questions, Minister, if I might bring up, I suppose the recruitment process. Now, I was able to listen. Apologies, I wasn't in Leinster House the full time, but I was able to listen through the teams here. But just the recruitment process with the HSC, I suppose, I don't know if you're able to answer this now, but what measures are being taken to accelerate this process? I have worked and I have experience of dealing with this. I understood that wonderful word you mentioned, backfill, which is, does this happen in other European countries? I mean, what is the process for recruitment? Why is it taking so long? I know about this backfill role, but, are we able to recruit from outside the HSC, as this is causing huge impacts to us delivering a service that is urgently required? I do think this has to be taken into account. And I would like, I suppose, a more in-depth understanding of the recruitment process within the HSC, particularly around mental health services, and what's been used or done to speed this up. Because it's not good enough. It really just isn't good enough right now to say that it's taken 8 to 10 months. You said there, I think 40 positions out of the 153 have been filled. That budget was announced in October of last year. That's 12 months later. And I know people within the HC are doing their utmost to try and manage. I know it's extremely difficult to even get nurses right now. Don't get me wrong. There's a lot of pressures within our system. They've dealt with the pandemic and a crisis, but we need to look at how can we help accelerate these measures for recruitment to support the HSC, to support delivering staff where they're needed and in resources where they're needed. And I'm sure any teams in the HSC would welcome any measures to improve and increase and accelerate this process. So that's, I suppose, one of the questions for me. You also spoke about Galway and CAMS, and it was very good to hear, as you've mentioned, in comparison, that I suppose the waiting list there have been reduced. And you mentioned the cafe. I mean, I worked in UHG grounds when I was in NUI Galway, and I worked with the health services there. And actually, it's Mr. Waffle, a wonderful cafe, and I'm delighted to hear about that that sort of incentive, that measure that you put in place. I think it's very welcome. But also, Minister, within 2 weeks ago, there was front page article of a mum speaking about why was her son, let go from UHG hospital. And, there are terrible incidences there, and, where we have Clada Watch in place, where they're monitoring the river for people that are obviously looking to take their own lives and that have either been released from hospitals. I suppose what I'd like to know is a little bit more about the acute services. You've spoken very well, and I know that we're doing an awful lot with community healthcare services, community settings, but very much about the acute areas. What has been done through the healthcare groupings within our regions across the country? What has been done? And I know that CAFE is one measure, but I honestly, I know, like, say, in our area where I am, Roscommon Hospital has a psychiatric or a unit there, but what is involved in other places? It's just been a little bit shocking, I suppose. I'd also like to ask, and again, this may be again for the HSC, but what engagement do you have with guards? And when it comes to, say, frontline, or is it blue light services they're called, when it comes to paramedics, what is the liaison there between those groups and the acute services and, say, community healthcare West, for example, where I am? How can they feed back? And I'm assuming they all get wonderful training to deal with these types of events, but it's very, very traumatic. And I know counselling is put in place, I know, for a number of those frontline workers as well. The digital divide, I know you mentioned as well, Minister, and I suppose just a spokesperson on education on the Fine Gael side, the Mitigating Against Educational Disadvantage, that's a fund, and I think our Cahirla brought it up. I mean, that's a great fund. It's been rolled out through the ETBs. Again, it can be accessed by community groups. I suppose it's really just to highlight that community groups could apply for it. Now, apologies, I don't know is the deadline date that we may have come past it, depending on what county or local authority you're in. But that's a great way for community services to access funding to promote if they're doing further education. They could do things like teaching materials. They can borrow and lend. They can have lending schemes there for laptops as well. But also, I've just advised people to link in with their local libraries as a great way to find out more about those funding supports for laptops and like that, the digital divide. Minister, you mentioned as well meeting with Minister Norma Foley, which is excellent. And I suppose I sit on the Education Committee, and I know you're looking at mental health supports there for primary and secondary school care. You know, it's really important that the Minister takes account as well of the report that we brought out on bullying through the Education Committee. There are a number of recommendations there. 1 in 3 kids, you know, with cyberbullying. This really impacts. And the really shocking thing to me with that particular report was that primary school, that there's even a higher level of bullying at primary school level. I must admit, I would have presumed it was perhaps more secondary school. So I would really appreciate if you are speaking in relation to mental health supports for primary and secondary schools, that we could look at some of those recommendations of that recently published just before the summer education report on bullying and cyberbullying in our schools. And I suppose also I think Minister Simon Harris is also looking at some of those supports at 3rd level, which, you know, would follow on really for young people as well. The 1 or 2 other apologies now, I'm doing a firing question.
We've lost your gone on mute.
Oh, sorry. Apologies. If you'd like to come in, Minister, I think you might be on mute actually, and I might come in with just a final few questions. Thank you very much, Chair.
Just before you come in there, Minister, can I just remind Senator Dolan that we don't have the HSE in today, just because I know 1 or 2 of your questions has been directed to the HSE. It's just the department, but we will have the HSE in next week.
Right, thank you very much.
No problem.
Okay,
thanks,
Senator,
Minister.
thank you very much for your questions, and thank you as well. Another wonderful advocate for mental health, yeah. And I've spoken to you so many times in relation to this, and I was just going to say that. So, who I'm joined with today, I'm joined with my key people in the mental health unit in the Department of Health, and I'm surrounded by people who support me every day of the week, and I just want to thank them for all the work they do. You will be able to raise next week in relation to the recruitment with the HSE, and I hope you do, and I really hope you do. So the way recruitment works is, so in my budget last year, I would have received the funding for 153 whole-time equivalents. So as I said earlier, we have 40 recruited to date. Now, what I have done all year long is I would have met with, every 2 months, I would have met with the key people in the HSE to see how that recruitment is progressing. And as I said, recruitment in relation to the clinical programmes has really gone very, very well, and we're hoping to have almost all in post by the end of the year.
Yeah.
Recruitment from the HSE is outsourced to the National Recruitment Service, and so that's how the HSE do the recruitment. It's outsourced. You know, they don't deal with it specifically themselves, so they should be able to answer a lot of questions for you there. Now, we are putting a greater focus on local recruitment campaigns which are targeted at local posts. For example, in relation to, and I'm crossing over, but in relation to healthcare workers to support people with home care at home, if we find areas where we're specifically targeted, we put in localised recruitment posts there to see can we get key people at the right time, which is hugely important. So I suppose, you know, it is really important. It is a challenge. It is a challenge. And, you know, I suppose if it was the same last year, it would be the same this year. Most of the staff come into post by the end of the year. But once they get in there, that's the most important thing for me, that we get them in there and we get them in post. Would you be able to tease that out more? You will be able to tease that out more. In relation to CAMS, for example, there was a huge emphasis put on recruitment over the last 4 years. So like there was 114 new assistant psychologists and 20 psychologists recruited to the HSE primary care since 2018. And we also have increased undergraduate psychiatric nurse places by 130 overall per year, including for CAMS. So, and you know, I have spoken about this with Minister Harris on several occasions in relation to dietitians, because it's so important that we have the joined up thinking in relation to what we need, you know, in the 3rd level sector. So if we have challenges around dietitians or in relation to psychologists or in relation to mental health nurses, They will. It takes a few years for them to come on stream, but at the same time, the most important thing is that we're aware of it and that we're trying to sort it out. You asked me in relation to the acute settings. So, so the acute settings, I have to say, I have to compliment the Department of Psychiatry, the psychiatrists, the DOPs throughout the country. They were able to maintain supports for people with very ill mental health up to 90% during the pandemic. And they also coped very, very well with challenges in relation to some premises. So we've 66 departments of psychiatry throughout the country, and 52 of them, I suppose, would be really, fairly new bills. So we're still working, we would have challenges, but I was delighted in the capital plan to announce a new 50-bedded unit for Waterford, a new 50-bedded unit for St. Luke's and Kilkenny. The reason why this unit is coming to Waterford, for example, not just that because I'm living there, but in 2012, we have capacity issues for many years. In 2012, the Department of Psychiatry was closed in Wexford. All supports moved to Waterford, and we didn't increase the capacity. We did have a service level agreement with St. Patrick's in Dublin, but to be honest, we were really challenged, and it's great news. I suppose, when we make these announcements, it's fantastic, but what we want to do is we want to see them up and running as quickly as possible, and we know it does take between 3 to 4 years for that to happen, but at the same time it is a positive move forward. I will be actually meeting with the ECDs, so the executive clinical directors who run the Department of Psychiatry throughout the whole country. I think I'm meeting them someday this week. There's a lot of meetings in the diary, and I do meet with them every quarter, and they would raise any challenges they would have. Obviously, they do raise issues in relation to bed capacity. So as you might have missed that earlier, we are in a bed capacity review to see what challenges we have. In relation to, I know you asked a question, what kind of, you asked in relation to liaison with the Gardaí. So a number of issues in relation to Gardaí will be addressed through the new task force on criminal justice. Philip spoke about it earlier. So there's a new task force in place. We're working very closely with the Department of Justice. Kathleen Lynch has been appointed as an independent chair, and there is training available for Gardaí. And that's another issue I think that's hugely important, that they can recognise that when a person has ill mental health as against, it's something I look very closely at. I recommend training for people so that they can recognise that somebody might have dementia, for example, and they don't recognise the signs that are there. But if you have, I hope I've covered all so far, Senator.
Thank you. Thank you very much, Minister. And I know I have a couple of other questions, just to compliment you as well on your Green Ribbon. It is Green Ribbon Month, isn't it, for mental health in September? And I know there's a number of events planned. You might maybe mention at the end, maybe one or two that are coming up, perhaps. That I know that there's one there on exclusion, I think, next week as well, so, or perhaps this week. But I suppose just some of the other questions I might pose, Minister, and again, this may be more so for our next session with the HSE perhaps. But assistant psychiatrists, I know that this was a role that was developed to look at waiting lists. And I think those roles sit within the CHOs of different areas, so within the community healthcare side. I suppose if the HSE would be able to give us an update on how many of these positions have been filled, perhaps what an impact they're having in terms of reducing backlog. I think they were intended to take on some of the roles that psychiatrists may have been completing in terms of being an advanced assistant psychologist, and that they would be able to help us reduce some of those waiting lists. So I'd just be curious just about that particular role. I suppose e-health as well. So in other words, e-health, I know has gotten a huge amount of funding, well, huge, but I mean, they're dedicating funding to that because they've seen exactly how important it is. And I know the HSE cyber attack has, absolutely decimated the service, even more so I think than anything they were dealing with COVID, which is absolutely shocking. And I know they're still recovering a little bit from the impacts of that. But I do think the importance of the electronic medical records, I think it was Deputy Horrigan, I think might have mentioned that earlier. It is really crucial. I would like to know, out of e-health, what percentages have been allocated to mental health projects or mental health ICT or IT projects from that fund, or what is planned for the year ahead, and what impact will that have in terms of mainly reducing our waiting lists. Again, West Be Well, I just wanted to compliment the department and everything else on that initiative. I know it's been rolled out in the West and it's covering a number of counties. I know our libraries are doing an awful lot of work within local authorities around providing information around mental health and so on. So I really, I suppose, to acknowledge that. I think Minister Frank Feehan is probably over the Healthy Counties Minister, is that right? And I think that's so important about how we are providing information in an accessible way. It's particularly in rural areas. For me, obviously, it's Roscommon and East Galway. But, we are looking at very rural areas where sometimes we only have the mobile libraries, or, how are we getting that information out there? You've mentioned the 250-bed units, which is wonderful to hear the investment in Waterford and Kilkenny. I think there's also a development in Portrane, I think, which is closer to us here in Dublin. Is that the forensic central unit, which I think is a community setting? I just thought maybe in safer times, I know this mightn't be the right timing, but it would be great perhaps for our committee to have an opportunity to see perhaps like a setting like that, if it was feasible, and obviously in a safer time, but just to see what has been provided. I think that state-of-the-art sort of facility, probably very similar to the facilities you've mentioned in Waterford and in Kilkenny, and sort of what's needed in other regions across the country. Perhaps this is a template that we will be working from for our other areas. Again, Ballinasloe, St. Bridget's Psychiatric Unit would have been the hospital in our area here that did provide acute services and addiction services. And, there is nothing in this area, in our local area right now to that has replaced that at all. I understand the move towards community-based provision of care, but, we do need something there as opposed to not having anything to replace it with, But I understand that we are doing an awful lot through the CHO. I think that, sorry, Minister, very last question would be, you mentioned that it's a difficult measure, the statistic that was been mentioned there in terms of the percentage of funding in mental health, and how it skewers it because there's a higher proportion coming into health. Perhaps it may be more so like a per capita or something like that spend might be another statistic that we could look at. We're having a higher percentage of our population. I know we haven't had a census, but there's been recent indications of a higher 65 plus. Obviously, a lot more on your projects, Minister, and I know you've done so much on this in relation to dementia and so on. But that's going to become a real concern, particularly in our rural areas, how we're supporting carers and families in those areas. But just perhaps a per capita, how we look at that and measure that year to year might be how we get a better understanding of the spend for mental health within our area. Ciarán, thank you very much for your time, and apologies for just being late to come on the video for the Leinster House side. Thank you very much.
Thank you very much, Senator. So look, thank you for your comments in relation to the Green Ribbon. I always wear it proudly. I travelled to Cork a couple of weeks ago to launch the Green Ribbon campaign in Cork with Mayor Colin Kelleher, and it was a great visit. And today in the post, I'll just reach back and get them. In the post, I got 20 lovely Green Ribbon face masks. And I was trying to see how would I give them out. So I've decided I'm going to be like Ryan Tubridy, one for everyone in the audience, but I'm actually going to give one to each member of the Oireachtas Mental Health Committee. I thought that would be the best way to distribute them. I do have a ribbon for every Oireachtas member, every Oireachtas member, whether it's the Dáil or the Shannon, but you get the face masks. So we get them over to you. So the Sea Change on the 15th of September, they have an event, Feeling of Exclusion, and the details are online. So look, I just want to commend them for all the work they do in relation to stigma. And the one thing that the COVID pandemic has done for us over the last year, 18 months, we are speaking now about our mental health. We are speaking about mental illness. Yeah. We are speaking about our well-being. We are speaking about, anxiety, distress, depression. So it's great to see that. In relation to Portrane, so Portrane is going to be, Portrane was something that was almost finished when I came into post. A huge amount of work done by previous colleagues over the last many years at a cost of 200 million. It will be the most state-of-the-art forensic hospital that you will find anywhere in Europe. And we are just really looking forward to getting it open as soon as possible so that the residents in the Central Mental Hospital will be able to transfer there safely and securely and be able to enjoy the benefits of it. I did visit Portrane. It's absolutely spectacular. And I have no doubt the 20-bedded unit for CAMS and also I think it's 10 for CAMS and 20 for the female residents will make, it will just mean such a better quality of supports for the residents when they get there. So we're pulling out all the stops. I know Seamus is working really hard on it to get this over the line and get it opened as soon as possible. We won't lose an hour on it if we can possibly do it at all. Just that there are restrictions that we're dealing with. I work very closely with Minister Feehan, especially on the I suppose the well-being and the keep well side of things. And just to say, for example, last week we would have met with men's shedders as they're called throughout Ireland now. We have more men's sheds in Ireland per capita than any other country in the world. We have 450 men's sheds, and it's just a fantastic model. And it's just the way, I think it's the type of these facilities. So I'm really looking forward to it on the 20th of this month. So it's only a short week away. So the likes of the active retirement groups, the likes of the bridge clubs, the knitting clubs, the card groups, all of them will be able to go back indoors and will be able to meet again indoors facing into the winter. And I just think that whole issue of reconnecting in society, where we can touch it now at this stage, it's so close. And I believe that will really support people, especially people who might have been at home a lot, who might have been in isolation. And it can be the loneliest day for you, and you can be living on you can be living on the high street. You can have neighbours on either side, but you mightn't talk to anybody. In relation to e-health, I don't have the percentages, but maybe we will be able to get those answers for you in a written reply. Would that be okay? You asked questions in relation to of the funding provided, what percentage was spent, I think, on e-health. Was that your specific question?
Yes, it was really just to understand from the e-health budget. I'm sure that it's been dedicated to a lot of different areas, but I suppose what projects are they looking at for the mental health area that would support your department in your area to deliver what you need to do in the next while? I suppose I'd just really like to know what is it they're looking at. There might be some things that are relevant maybe for the whole health.
We did very quickly provide 1.1 million to the various NGOs, the likes of Jigsaw in My Mind and Pieta and all the Samaritans, all the organisations that support us to move to a blended approach, to move online very, very quickly. So that was provided last year, and I know more finances have been provided this year, but we'll get you a written response on that if that's okay, Senator.
Okay. Thank you.
Yeah. And thank you very much again.
No, thank you very much, and thank you, Chair, and thank you for mentioning men's sheds. Actually, there's a very excellent one in Ballaghareen. I know Pat Toy is a real advocate, and I suppose just one of the points, as you mentioned, of areas opening up. Day services, I think, are so crucial, particularly social services that are in our community, in our smaller towns. They give such respite, and there's so many older people that are looking to come back to having the, linking in with their local social services and the activities that they provide and the care and the meals and so on. So I do think that's really, really crucial. So I hope that maybe with the Minister for Health that you would be very supportive of seeing those opened up. Sometimes there's a few challenges because accessing medical supports for those services can be difficult. So our public health nurses are crucial for that as well.
So that actually falls under my remit, the reopening of daycare centres. So to date, we have 120 of them open. Have more open before, every month.
Very good.
Where we are challenged is, so for example, yesterday I would have visited North Tipperary and I visited two facilities, the Dean Maxwell Nursing Home and the Hospital of the Assumption in Thurles. Both those are long-term residential care facilities, and when people attended for day services, they used to mix with the service users who are living there, stay home from home. But unfortunately, the challenge is that when you're coming in from the community where COVID and the Delta variant is still prevalent, it's causing a lot of challenges to mix with the residents who are living in. The daycare centres that are just standalone daycare centres are back open, the majority of them. And I'm delighted, as I said, that 120 are open, but we have more work to do on them. But it's so important we get them all open as soon as possible. And also respite services, something we're working really hard on. They have opened in some areas, and we need to get them opened everywhere so that we can support older people, whether they have mental illness or not, to age well at home.
Yeah, the loneliness and isolation. Thank you, Minister. I think it sometimes always comes down to the funding question. But thank you very much for your time.
There's no